what Medicare for All means for babies with medical conditions. That's what's coming up on this edition of Pro-Life Gen News. Hey everyone, I'm Kelly and this is Pro-Life Gen News. This week, Students for Life of America's president, Kristen Hawkins, got a chance to sit down with Fox News and share why the Democratic campaign promises of Medicare for All is a legislative disaster, especially when it comes to those with medical conditions. Take a look.
All the Democratic candidates are raising their hands saying that they support some form of government-run health care, of this Bernie Sanders Medicare for All plan. But it's time for people to start reading the fine print as to what that means. Two of my children, Gunnar and Gracie, have cystic fibrosis, which is a hereditary genetic disease that will end their lives prematurely. It's a very expensive disease. It costs thousands of dollars each month for their medication. And very time-consuming with their treatments. And what we've seen in other countries that have nationalized health care programs, those children with CF do not receive the same amount of care my children here in the United States have, simply because they're Americans. And we live in a nation that spends far more than any other nation for biomedical research and advances. The cure that we're hoping comes within their lifetime is going to come from the United States because of our health care system.
Currently, people with private insurance pay a little more than those on Medicare, allowing hospitals and doctors to stay afloat. Without private insurance, hospitals would lose $151 billion in annual revenue. According to Kristen Hawkins, a government-run system in which bureaucrats decide how much they will pay, if anything, and what should be covered will result in extreme healthcare shortages. Doctors and services go away when the government decides what it will pay, resulting in a lack of coverage for costs. We're already seeing the effects this would have here in the U.S., with veterans unable to receive life-saving care because the government-run VA centers are unable to handle the load. The same is happening overseas on a much larger scale, as the UK just recently allowed life-saving drugs to expire, all due to a standoff over price. So what does this mean for those most vulnerable amongst us, particularly the preborn babies and newborns with medical conditions? Danger. Especially those babies who are diagnosed with Down syndrome or cystic fibrosis. The abortion rate for these babies diagnosed with these disabilities exceeds 90%. The most vulnerable will be sacrificed in the name of cost-cutting and in service to an agenda that devalues them. As the pro-life generation, we will not go quietly and watch this happen. We will continue to fight and stand up for the right to life, no matter the age, the stage, or the medical condition. That's a campaign promise you won't hear the Democratic nominees sharing on the road to the 2020 presidential election. That's all for today's episode of Pro-Life Gen News. For more on these stories and the latest in the pro-life movement, head over to studentsforlife.org and continue to follow us here on Facebook. Don't forget to like and share the content you're seeing here to help us spread the message of hope and life in America. Thanks for joining us. I'm Kelly, and I'll see you next time.